Życzymy Państwu przyjemnej podróży.
Proszę Państwa, niezależnie od tego...
Ladies and gentlemen, irrespective of what is said about the health services, it's much better to be healthy and rich. But the truth is, everyone here has at one point in life been a patient or will be in the future. My name is Agnieszka Urazińska. I'm a journalist of Gazeta Wyborcza and Wysokie Obcasy, and I'd like to invite you to a debate, meeting devoted to health. The title is Competition or Complementarity, Public and Private Healthcare. But in fact, this is all about patients. We're going to discuss money, principles, deficiencies, but by the end of the day, we have patients. So, welcome, and I'd like to introduce our experts. Paweł Wajda, President of the Supervisory Board, the PZU, Zdrowie. Sławomir Dudek, President of the Institute of Public Finance. Wieczorek, Deputy Mayor of Łódź. Artur Dunin, Senator of Poland. And Tomasz Karauda, academic teacher and doctor. So, how is it to be a patient in Poland? Let's start with you. Thank you very much. It's a very difficult question because I'm not a patient right now. I'm, let's say, wrongly diagnosed. As you know, there are no healthy people, there are only those who haven't been diagnosed. But on a more serious note, being a patient, irrespective of whether you are treated by public or private healthcare, it's very difficult. Now, to give you a concrete example, I would like to note that at the core of our meeting is what our host said. It's better to be healthy and rich, and this thesis is definitely confirmed by this year's Nobel Prize in Economics, as the three winners of that prize concluded exactly the same. Those societies that are healthy and rich, those who focus on building democratic, social, and health institutions are much healthier and much richer than others, than societies which do not invest a sufficient percentage of GDP in health. Now, I'd like to draw your attention to the fact that a Polish patient, on average, has two major problems. Sorry, but ladies, don't listen to this. The patient is older and older, and also more sick. And this is a kind of a vicious circle, because the fact that people are more mature and more burdened with illnesses, this implies that they require an increasing number of medical treatments which are less available. And again, they place an increasing burden on the social insurance system. And so, in a sense, there is less and less money in the system. So, in contrast to the Nobel Prize that I mentioned, the patients are becoming older and sicker, and so this is the problem. I didn't like the statement that patients place a burden on the system. Okay, so I participated in a health panel in EFNI in Sopot, and they said that people who are 50 years old and older, they usually have two chronic diseases. But what I want to say, I deal with public finance. Patients are also taxpayers, and they need to be treated fairly. On the one hand, we are patients and we want to have high quality services. On the other hand, we are taxpayers. So this is the task of the government, perhaps NGOs, financial education. The government doesn't have any money of its own, only taxpayer money, and the task of the government is to collect money from taxpayers and organize a health system to ensure high quality services. However, it is not the only basket of public services. We want to have a police, a strong military, education. Now, I deal with public finance, and I'm invited to different conferences. There are different silos, and when I'm invited to health conferences, they want me to allocate as much money as possible to health. The military, same situation. Education, same thing. I also work at the Warsaw School of Economics. I work in education, so the Institute of Public Finance, together with the National Health Institute, published a report on the financial gap in the National Health Fund. Now, the contributions are insufficient even if we take into account the 1% of GDP promised by the government. Now, the subsidy to the National Health Fund comes from other taxes. And this is not fair, because the government doesn't say, okay, we can contribute to health, but then you will have fewer money on education, or perhaps we can increase remuneration in the public sphere only by 5%, so on and so forth. Of course, spending on the military a lot, but that's a different story. So, on the other hand, people do not necessarily want to pay taxes. So it's not the problem to expect the government to subsidize National Health Fund. So now, what is the fair conversation? The VAT was increased from 22 to 23%. It was supposed to be decreased, but it will never be decreased, or perhaps even increased further to subsidize the health. Now, during the COVID pandemic, we were able to see dramatic scenes, and perhaps people would have been willing to allow an increase in premiums, health premiums, but no, people didn't want to pay more. And no government, no politician can afford that, because just the population doesn't want it. There is no system thinking, and I'd like to inform the patients, educate the patients. It is a government's responsibility, the responsibility of the academia and NGOs to provide these data to people. And so if we don't remember about this background, we cannot solve the problem. Okay, now Mr. Mayor. Now I'm going to public finance and from public finance to patients. In Poland, we have a Bismarck model of healthcare. There is a defined scope of services. So citizens have an unlimited access to services, while we have a limited financial and human resources. So we do have financial limits and personnel limits. And by the end of the day, the patient is placed in a line, in a queue, because the availability will come in the future, but not immediately. So from the perspective of the taxpayer, if I pay a premium or a contribution, I get poor services, I will not believe that I will get something better, even if I pay more. Now, from the perspective of a patient, okay, let me translate it into the private market. If we purchase a plan or subscription for some services, let's say, if we pay a premium, do citizens know what exactly they get? If we purchase some private subscriptions, we get a lot of bonuses. But so if we look at all generations, we as society, we must know what we get for our money and how the system works, because I know exactly the system of healthcare. But if somebody falls seriously ill, sometimes we don't know where to begin, or should we go to the same specialist, or perhaps we should already be in a hospital. On the other hand, is the same health problem could have been dealt with at the level of primary health care, because we don't really know. So the social education in terms of healthcare is very important. Where to go, how to move around. Other element is system solutions. For example, coordinated healthcare, where in a systemic manner a patient with a certain illness migrates appropriately, follows a specific path, so we make it easier to go through this healthcare system to help him or her recover more swiftly. Now, with all due respect to the previous speakers, now I'll ask a question to the public here. Let those people raise their hands who who hasn't ever sworn or because of healthcare? No, now listen. Now, what are the patient's expectations? I am also a patient. Okay, you may say I'm a special patient because I'm exceptional. I'm a senator. I have some friends in high places and so on and so forth. Okay. Now, I want to see a doctor without a long line. I want to know where else to go to regain health. And this is what we miss here. I think that most of you, just like myself, I go to a private clinic because it's closest to my home. So we start, well, we cease to differentiate between a private and public clinics because many of those services are paid by the National Health Fund. Now, services can be provided by both private and public clinics, but with different quality, and the quality highly varies. It really depends on the person. Even the best act of law procedure can be deformed by the human factor. It seems that the National Health Fund, which is trying, well, I'm going to press on this. Now, we are talking about money. When we talk about patients, we talk about money or a lack thereof. As I can tell you honestly, there is no discrimination of private entities with respect to public entities or public clinics. Now, National Health Fund conducts very clear tender procedures, and whoever meets the criteria and provides better conditions wins the contracts, and I'm very happy about it, because if we have a domination of private clinics, okay, let it be so, let people go there. Okay, I asked about patients, but hopefully we will get there by the end of the day. So, okay, we as patients, we want to know, and this is the task, everybody's task, a task of all, everyone who can talk to Polish citizens, to show what the situation should look like and where we should be going. We can't get there without money and without people involved and committed to their work. Now, doctor, we are looking for the patient.
It is said that we have equal access to healthcare system, but in practice, those who have thicker wallets get quicker access to the healthcare system. I work at the university hospital, but also at a county hospital. I often see how whole families contribute to pay for a visit for their grandfathers or grandmothers, because when there is something wrong with health of a person, well, they usually go to the clinic, to the physician, and then they learn that they will be able to see a specialist in a year, in 12 months, in 13 months or more. So they think, what will happen to me? Should I wait these 12 or 15 months, or are there any other options? Fundraising for buying a visit to a specialist within the private system. So I must find money to pay for this visit and to learn whether my condition is serious or not. There is another option. Well, I feel well, but it may get worse. Or if I'm afraid of what will happen to me, I can go to the emergency ward, to a hospital. That means, and then I will be tested. That means that those who have money will get access to healthcare more quickly. Well, physician's advice is an unlimited service. I've been working at an outpatient clinic for some years, and often I have 15 patients. They not only come to get a prescription, they are often patients who were here and there, and they waited for 7 months to come and see me. So these are elderly people. It takes time. I examine the patients, and then I say, well, this, that, and that should be done. And when I look at the queue, I know that I should be seeing these patients in 2 weeks. But if he gets into the queue, I will see him in 8 months' time, and that's too late for this patient. So I add her or him on, even though I don't have any time left for new patients, but I add the person on to the list in 2 weeks' time. Well, in the meantime, a patient goes out of hospital and has to be consulted, or I get the recommendation from the emergency ward, and suddenly out of 15 people, I have 30 people, and I work at the clinic between 14 and 16, that is 2 and 4 p.m., but I stay until 6 p.m. because I don't want these patients to feel ignored and want to see them on the day when they should they should visit me. Well, when I broke my leg, and it turned out that at the end my gypsum was to be removed, it turned out that they didn't have time for me to take it off. But and I realized that to be able to have this done within the public system, I would have to ask for the visit 2 weeks before I broke my leg. So that's tragic. Well, that's funny, but that's tragic. Well, so either we as people say, well, I'm a human being, I have to take care of my patient, I can't put them at the end of the queue, but I want to go home. That's why many doctors don't want to work in outpatient clinics, because there are waves of patients every day, and there is a total chaos. But many specialists, doctors, want to work in private clinics. They studied and they were learning for 12 years, and they say, I want to work calmly, and I want to make more money. I work only right now only at the public sector. I'm not going to leave the public healthcare sector. Maybe I will add on the other one, but the patient's perspective is really very, very poor. Well, when I said that I would be moderating this panel, well, all of my friends and colleagues had their own stories to tell me. My colleague with a problem of a thumb, she went to a doctor and she learned that the surgery would be necessary. She has to be operated on, and it will be paid by the National Health System, and the operation will take place in 2029. But if she pays 6,000 or 8,000 zloty, she will have it done immediately. She was disappointed, but she said, okay, I will pay, and my thumb will be okay. So now let's swiftly go to the private sector, because the data show that increasingly more people buy private health insurance. And these are really record-breaking amounts of money, and we are crossing further borders. Thank you very much. Yes, what we can see recently is the fact that increasingly more people are buying private insurance to be able to use the private clinics and hospitals. And that's the effect of what we've heard from my colleague panelists. There is nothing like a free lunch. When speaking about the economy, there is nothing like a patient for an unpaid patient in the healthcare system. So when patients have to wait for endocrinologist, or sometimes have to wait 2 years until you get until you can have an appointment within the public system. So people turn to private clinics or do the private practice. Well, there are also employees' benefits or bonuses offered to employees. They can become parts of privately paid healthcare schemes. One of our customers, when recruiting new people, used as a kind of incentive or encouragement by telling them that they get not only standard health care, but also a full range of dentistry services. So that was to encourage these people to work for them. But like in economy, there is nothing like a free lunch. So each coin there are two sides of each coin. So, and looking at data from before 2 or 3 months, and I mean these people who have purchased regular private healthcare insurance, and already we have around 5 million people who have bought such subscriptions. That means that also again this quality of care will deteriorate, because the business model, and let's not pretend that this is not business. Let's not pretend that this is a mission. This is not a mission. This is business. Well, you in the public clinic, you have lots of patients, but in a private clinic, doctors know that they can spend only 15 minutes on a patient, independently of how old they are. Sometimes elderly people can't even take their clothes off to be examined within these 15 minutes, but they have just 15 minutes for that. Well, of course, this private healthcare is adding on to what is offered by the public sector, but let's remember that this private system will also get clocked at some point. When I read the reports on financing private healthcare, the direction is that certain problems will be transferred also to this private sector. And then what we know from the public healthcare system will be experienced also in the private healthcare system. I'd like to tell you that from the data that I have come across, I learned that every 7th Pole gives up treatment, and most of us additionally pay for healthcare. As a researcher, I found a study of Iranian researchers they are also discussing their healthcare systems. Their supplementary insurance. This is the paradigm of WTO and WHO, saying that we need to have a supplementary coverage, insurance coverage in the private system. They carried out a meta-analysis of papers. And then they focused on 60 out of them, and the conclusions are similar to those that we've just heard. Well, these systems, these supplementary, complementary systems, or the supplementary systems, these are which add-on complementary systems offer similar services, so their conclusions, because that's the situation. Well, what we have in Poland is also in other countries. In France, for example, this share is very, very high. Well, I've given you the background. We don't want to pay higher taxes, but we want to have high-quality service. So we are in a trap. We've painted ourselves in the corner. There is no way out. We have to develop these services. We have to, because please imagine what would happen if this quite a big proportion of society stopped using this private healthcare sector. What would happen to our public healthcare sector? In Poland, dentistry services have almost always been private. Well, we've come to terms with the fact that we have to pay for that. But we complain. Some people don't go to the dentist. I think that we are also probably too negative about our healthcare system. There are issues where there are improvements. It's not the case that it's bad everywhere. But in this report, they speak about additional fee for getting better food, or and what the mayor said, we need competition. Take a gym. If we can choose which gym we want to go to. Well, there are cheaper, more expensive, better, worse organized. There are tenders already. We can choose between public and private sector healthcare organizations where we go to get a service. But as the doctor said, well, we need to consider fairness, equality, equal treatment, constitution. I think there is a lot to be done, but that's very positive, and we have to take advantage of it until citizens regain trust in that. We have to improve the performance of the public healthcare sector, and I believe that we also waste quite a lot of resources. There are lots of, sometimes very expensive equipment is not used as much as it could be used, or is not used at all. So I think that there is a lot of money circulating in the healthcare system, which is wasted. Well, outside of big cities, if you get magnetic resonance within the range of 10 kilometers, you can reach it much more easily than when you have the same equipment in a hospital at a distance of 10 kilometers in a city, where it's much more difficult to move around. Well, sometimes these services overlap, or if the and money is spent in both sectors. We don't have enough coordination within the public system. We all do aptitude tests before we start a new job. Well, but then these data don't go into the system, so we need to educate the patients how to move around and to have more coordination. And also, the studies have shown that it's systems where there is some kind of contribution, sometimes very small contribution from the patients for additional quality, and the same also in the public sector, then the synergy between the private and public sector is even better. But we have these political clashes and demagogy. But there is a light in the tunnel. Well, I'd like to ask the mayor, are we optimistic? Well, so many aspects have been discussed. Well, I could talk about it for 3 hours. I defended my PhD thesis at the Warsaw School of Economics, and I started it by a quotation, well, medicine is money and about money and health. The main problem of the healthcare system is not the lack of funds and money, but the correlation what we deliver and what we expect. Well, you can have a system which, with these funds, can offer high quality service. Well, in this Bismarck model, it's all diluted because we offer all range of services. My long discussions with Dr. Tomasz Karauda about the problem, the biggest problem of healthcare system, and this problem is the lack of sufficient human resources, medical staff. So right now there is competition between the private and the public sector. I'm not going to tell you anecdotes and what happens in the public healthcare system where a doctor says I won't be on duty today because he's just been offered a rate twice as high in another hospital. That increases the cost of the system. And I'm not saying that against the medical staff. I also graduated from the medical university. My wife is a medical personnel member, but costs of human resources, medical resources, have increased tremendously. In the past, at one of our city hospitals, the cost of medical staff accounted for around 60% of the budget. Right now, it's 80%. If the doctors should focus, of course, on patients, but there are also buildings, there is equipment, we have to take care of the quality of the maintenance. So how much is left? I'm always annoyed by the discussions, well, should it be 8%, 7%, 200%? What I'm interested in is what we get from it, because with the system as we have, we just take money from the system and we transfer it to the pockets of the medical staff, and we don't get anything. If we say, well, 7, 8, 5%, 1% goes directly on the modernization of hospitals in Poland. Then and this 1% is several billion. But in our model, this money disappears somewhere in the system, and we don't get anything more as patients. So these aspects of public and private healthcare sector, well, obviously, doctors, when they see what's going on, when they see the chaos, they go to the private establishments because they want to work normally, they want to offer better services, and they don't want to suffer from the burnout without several years. They want to also to use their knowledge to the best extent possible. So with all these deficiencies that we have in Poland, because if we look at Europe, the number of physicians, the number of doctors per 100,000 patients is the lowest. The same goes for nurses. If some, if part of them go to the private sector, the problem is even bigger. Well, in dentistry, we have 8 dentistry clinics which are free, offer services free to the patients. They have national healthcare contracts. Well, they offer different services. Just go to the clinics operated by the city, because I believe that if we have dentistry as part of services, we should be doing that. And I will tell you one thing. These contracts are not profitable to us. We just take what we make on outpatient clinics and we shift this money to dentistry clinics because we want to offer all these services. And today often the public healthcare system works in such a way that some departments are profitable and money from them is taken to those which are not profitable.
Let's move on, Mr. Senator. Yes, 2 issues were addressed. Yes, indeed, we do not have clear information about the patient and about the available services. Indeed, such a database would be very useful. And, I will talk about this with the ministry, because this information must follow the patients no matter where they go. So the doctors must be able to access that information. So this should also work the other way. The patient should not actually appoint a visit with 10 specialists for the same visit. Okay. Okay, but sometimes patients need to wait an hour just to get a connection to fix an appointment. Well, I think we should create a huge specialist database. But for example, we could have an application which would show us the available doctors, and we could decide which doctor we want to see, which is closest to our place or the soonest. If we, or let's say if we want to get an appointment sooner, we can find another doctor. So we could get an application. It's not necessarily a human being, although I like to talk to human beings. So I'm aware of that. So this is the basis for a regulation of the system, and to make it more patient-friendly, and it will also benefit doctors. Another subject that has been mentioned is the basket of services. If it is well prepared, well priced, then we will know exactly whether we need health premiums of 6, 7, or 8%, as Mr. Mayor said. And I know that it's being worked upon after my conversations with institutions and doctors. I know that okay, let me give you an example. Childbirth. Is it a normal childbirth or complicated? Whether childbirth is threatened by complications, the same amount is paid to the doctor or to the hospital. It must not be like that. This additional work that the doctor performs must be paid additionally. It's normal. Okay, the doctor performs more treatments, specialized procedures. Okay, we can say that the private clinics perform only the simple procedures. But then, okay, we need to transfer patients to a hospital. Okay, now you said that the private clinics are mostly about business, yes. Okay, a normal childbirth is simple. Okay, we will charge so much money for this. But let's say if it's a complicated childbirth, let's send the mother to the mother's hospital. But that is a problem for the Polish Mother's Hospital, because they also signed a contract only for childbirths. So I'm talking to the National Health Fund to add extra elements to the basket of services, and hopefully hospitals will not be in debt anymore, because they will be able to charge normally for the services they provide, and also the patients will receive good care. Okay, I'm very happy that we are moving on to solutions. Now I'd like to pass the mic to the audience. Now, doctor, what do you think about telemedicine or other solutions in terms of the deficiency of doctors in Poland? Now think about patients who cannot afford extra insurance. Now, myself, as a journalist writing about health over the years, I've heard, okay, I've been paying my insurance for so many years, I haven't been sick, but right now I need care, and they tell me to wait for years, and those people don't consider these things, that the basket is not priced correctly. So what can be helpful? So a patient for a primary care physician, a healthy patient that doesn't use any procedures, that's a perfect situation. Okay, the primary care physician has such a patient on their list, and that's great. And okay, the patient has been paying for so many years, and suddenly they are hit by a serious illness, and then they want to get appropriate services. Of course, there is a degree of complementarity. I'm very happy about it, that there is private health care. It's excellent, but the problem is that the private sector functions much better if the public sector functions worse. So the private sector picks the best morsels. Have you heard about private internal care medicine clinic or private emergency care? No, because that generates huge costs. Okay, you can pick those things that bring great profits. For example, children's psychiatrist, 800 zlotys per visit. And of course, we know that the public healthcare system can absorb any costs related to complications. So we need to make sure that the system is normal, it's not bureaucratic, and will be more beneficial. If you work privately, you bear the full responsibility for what you do. You are an entrepreneur, you sign contract, but you're responsible, accountable with your wealth, with your money for malpractice if something goes wrong. But in the public health care, the responsibility is diluted. You have this kind of group insurance and so on and so forth. So if everybody agreed to work in this system, everybody would be happier. Okay, it's natural that doctors move over to a private sector because they long for normal life. Telemedicine could be a solution, although it is only partial. Okay, because the quality of telemedicine was sometimes very low. And how can you osculate the patient via the telephone? But okay, but you can write a prescription. Yes, that's true. So as Mr. Senator said, yes, we could have a system that shows how you can make an appointment with a specialist and or recall an appointment. So indeed, as I'm at the clinic, 4 or 5 people do not appear, do not show up. About 20% of people do not cancel. I think there are other things to be done. Now, I'm sorry to interrupt you, but I'd like an opportunity I'd like to open up the floor. Okay, you can see 3 or 4 hands. So I'd like you to give very quick answers. Good afternoon, Katarzyna Maliszewska. I'd like to ask you about a very specific case. I pay taxes every month. Sometimes I need to use healthcare services. A specific example, I break my arm, I get it plastered up, and the doctor says you need to use physiotherapy. It needs to happen as soon as possible. Please arrange this at the reception desk. And the lady says, okay, 9 months time. Okay, great. In 9 months, my arm will not need any physiotherapy or rehabilitation. Okay, so I can't do anything, but you can have private services. When? Today. How much? 300 zloty. Over the coming 2 weeks, I do all the rehabilitation. I pay several thousand zlotys, but my arm is okay. If the same clinic, there is a doctor, equipment, and a room, what's wrong with the system that I cannot do this while paying my taxes? I use the same resources that the patient before me and after me. Now, but I need to pay several hundred zlotys. What is exactly the problem with our system? Now, who can address this question? Now, financially speaking, that there is not enough money in the contract with the National Health Fund, and you need to wait in line. Let's not mix additional health premiums with paying for treatments. Now, if we had an additional insurance, for example, at school, my son broke a finger, and a school offered insurance, and rehabilitation was provided for at a very low price. And so the question is, okay, the taxpayers or entrepreneurs, is it okay with them? Perhaps are you ready to pay a higher health premium or to pay for private treatments? Now, if we add money to the system and the system increases quality, then we would not increase the remuneration of the doctors, and we would just increase the working hours. So if we added money for rehabilitation, then suddenly so this is just the question of organization. Just a few words about the model of health system, but now in a nutshell. Now, once we get rehabilitation, and I kind of a specialist there, the question is what kind of rehabilitation we get from public health care. Now, let's say, if a rehabilitation specialist gives me lasers or something else, now in terms of, for example, if there is a problem with a joint has been damaged, then you need to work with a physiotherapist. So now physiotherapist can prescribe a huge variety of treatments, but the best treatment is one-on-one work with patient, and we cannot get it using the money from the state. Sorry, we cannot ask any more questions, so I'd like to my guests whether they are ready to answer your questions after the meeting. So please take this opportunity, given that we have experts with us, and because this subject really stirs a lot of emotions. Okay, I wish you all good health, and all panelists efficient work so that healthcare improves. Thank you very much.
Jedzą kanapki z kawiorem.
Nadzwyczajna kasa.
Obrażanie dziennikarzy telewizji polskiej.
Chodzi o działania polityczne.
Ratowanie ofiar dla pedofilów. Für Deutschland.
TVP Info. Włącz się na nowo.
Uwielbiam szycie w sieci. Wczoraj podszyłem się pod wnuczka, wieczorem uszyłem intrygę na apce randkowej, a dziś planuję grubymi nićmi szyte oszustwo z promocją. Tak się szyje.
Na oszustów są sposoby. Zapoznaj się z poradami ekspertów na niedajsiepodszyć.pl.
Rodzina spółek Pelion to 12 000 osób pracujących w ponad 300 spółkach w Polsce, Szwecji, Wielkiej Brytanii i na Litwie. Jesteśmy liderem w branży ochrony zdrowia. Od 1990 roku dbamy o długość i jakość życia. Pracować z nami możesz w jednym z 7 obszarów.
Radość, nadzieja, życie, wyzwanie, pasja, pamięć, zaufanie, pokój, jedność. Słowa tworzą świat. Polskie Radio. Źródło wiarygodnych informacji.
Plany biznesowe powstają z marzeń. Dlatego nie ma dwóch takich samych firm. Jedni chcą działać na całym świecie. Innym cały świat mieści się w dłoni. Sukces biznesu to nie tylko jego wielkość, ale też szczęście, jakie przynosi ludziom. PKO Bank Polski.
Polskie Radio.
Jedynka.
Zapraszamy do Trójki. Od nowa.
Trójka. Program Trzeci Polskiego Radia.
Czy wytrzymasz klockowe tortury? Ze stoickim spokojem. Czy w twardych negocjacjach zachowasz zimną krew? Czy poddasz się dobrowolnej eksmisji ze swojego łóżka? Brawo! Test na obecność serca zaliczony. To znaczy, że ty też możesz być rodzicem zastępczym. Dowiedz się jak na testserca.pl.
It's not always easy to recognize. It may look like this, or like this. It may be a burden, but it is a responsibility that we embrace nonetheless. But if it means this for one person and this for someone else, maybe it ultimately means being there for one another. It isn't handed to us, but we know where to find it. And how it feels, how it tastes, and what it sounds like when we finally have it. It means different things to different people, but for many, it means everything. And if we all fight for it, it will eventually bring us together.